Hello, Teresa.
Hi, Michelle.
Teresa, I'm about to take you through the adult pre-exercise screening tool.
Okay.
Okay, the purpose of this screening tool is to gather as much medical information as possible. This information also helps identify any contraindications that you may have to exercise. Contraindications can be something as simple as a sore knee, to something as major as cardiovascular disease. This screening also helps to determine whether we need to send you to a medical practitioner to get a clearance before proceeding any further. Are you happy to
Sure.
go through it? Okay, so stage one is to identify those individuals with a known disease or signs or symptoms of disease who may be at a higher risk of an adverse event during physical activity or exercise. This stage is self-administered and self-evaluated, but I can take you through it, which is good. Okay, has your doctor ever told you that you have a heart condition or have you ever suffered a stroke? Do you ever experience unexplained pains in your chest at rest or during physical activity or exercise? Do you ever feel faint or have spells of dizziness during physical activity or exercise that cause you to lose your balance? Have you had an asthma attack requiring immediate medical attention at any time over the last 12 months? If you have diabetes type 1 or 2, have you had trouble controlling your blood glucose in the last 3 months?
No.
Do you have any diagnosed muscle, bone or joint problems that you have been told could be made worse by participating in physical activity? Do you have any other medical conditions that may make it dangerous for you to participate in any physical activity or exercise? No? Great, okay. So because you've answered no to all those 7 questions and you have no other concerns about your health, you may proceed to undertake some light to moderate exercise or physical activity. Okay, which is good. Okay, so if you just get you to sign down the bottom there, Teresa. Thank you. Okay, so we'll just move on to stage 2 of the screening tool. This is to identify those individuals with risk factors or other conditions to assist with appropriate exercise prescription. This stage is to be administered by a qualified exercise professional, so I can take you through this. How old are you, Teresa?
52.
52. Female. Okay, so because you're under the age of 55, that puts you in the low risk factor for gender, which is good. Any family history of heart disease, stroke? No. Do you smoke?
No.
Okay. Just need to move on to some physical activity questions. Do you consider yourself sedentary, or you doing some light to moderate or even vigorous exercise at the moment?
I'd say moderate.
Moderate. How often?
4 times a week.
4 times a week. And how long for?
An hour.
Okay, great. Okay, well that's a sort of a total of 240 minutes, which puts us above the recommended guideline of 150 minutes per week, which is really good. So that gives you a risk factor of -1 there, which is fantastic.
Yep.
Okay, so your height?
170
centimetres, and your weight?
66.
66. Okay, so as we worked out earlier, your BMI is 22 kilos metre square, which sits well below the guideline of 30 kilo metre square, so that's really good. Have you been told that you have a high blood pressure?
No.
Have you been told that you have high cholesterol?
No.
Have you been told that you have high blood sugar? No. Great, okay, so that gives us a risk factor there of -1, which is really good. Okay, so just a couple more questions. Have you spent time in hospital, including day admission, for any medical condition, illness, injury during the last 12 months?
No.
Are you currently taking a prescribed medication or medications for any medical condition? No. Are you pregnant or have you given birth within the last 12 months?
No.
Do you have any muscle, bone or joint pain or soreness that is made worse by particular types of activity?
No.
Okay, great. Okay, well now that we've answered those questions, that's can allow me to assess your risk stratification, and which can be either low, moderate or high.
Mm-hmm.
Now you've scored a score of -1, so that puts you in the low risk
Great.
category, which is really good.
Mm-hmm.
So individuals at the low risk may participate in aerobic physical activity, exercise up to vigorous or high intensity,
Mm-hmm.
which is good. So we'll just refer to our chart, and on the chart here, that with your score you can work at the vigorous or high level.
Mm-hmm.
So you can work, up to 90% of your maximum heart rate. So anything in the vigorous and high area, and in the very hard training zone of an RPE of greater than 7, RPE being the rate of perceived assertion. So we can sort of get you into some really good quality high intensity training.
Great.
And the other good news is that that score's allowed us to move on without having to refer you for medical clearance to a medical practitioner. So that's really good, Teresa. So
Happy with that.
great, and from